Assalamu alaikum warahmatullah. Today we are going to discuss and to draw a skeleton of the case of history taking Station 2 in MRCP exam. Station 2 or history taking case is Station 2 and it is 14 minutes. He will give you 5 minutes before to read the scenario of the patient before going to inside the room to meet the patient or the surrogate. In these 5 minutes you have to read the scenario carefully about your role in the case and about the name of the patient, the age and symptoms. Then you have to write good differential diagnosis for the case, and you have to link all the symptoms together to give you more narrowed differential diagnosis. If you made a good list of differential diagnosis for the patient, so that your approach will be in proper way and you can reach the diagnosis easily. So in white paper you have to write your differential diagnosis. It may be 6 or 7 differential diagnosis. Then you will go inside the room to meet the surrogate. You have to shake hands with the surrogate and identify yourself. Then confirm the patient identity. Then confirm agenda of meeting. Then take permission from the surrogate to start the discussion with him. Then start with open question. Can you tell me more about your symptoms or condition, please? Then detailed analysis of the complaint, onset, when your symptoms started exactly, course, is it coming with you on and off or all the time with you, duration and the progression, is it increasing or decreasing, worsening factor, do you notice anything that worsens your condition, and you have to name these factors according to the symptoms. Then do you notice anything improve your condition, and you have to notice and you have to mention by name the factors that improve the condition according to the symptoms. Associated symptoms. Do you have any associated symptoms, like you have to name the symptoms according to the condition. Then you have to ask about the differential diagnosis list you made in your white paper. So that you wrote, for example, 6 or 7 differential diagnoses. So you have to ask all the symptoms for every disease that you wrote as differential diagnosis. Then you have to take detailed history about the systemic review of the patient, and you have to tell him that I'm going to ask you some question, maybe not related to your condition, but it will give us some value about your condition. Is it right? Then to ask about all the systemic review of the patient. General symptoms like high temperature, loss of weight, and lumps and bumps, and generalized fatigue. Then you have to ask about CNS or neurological symptoms all, cardiovascular symptoms all, gastrointestinal symptoms all, and genitourinary symptoms, musculoskeletal symptoms, skin symptoms, traveling history. But traveling history can be asked earlier if the condition needs to be asked earlier, like if you are expecting infection or like that. So you have to ask about our traveling history. And in traveling history, if there is need for traveling history and related to condition, you have to ask about all detailed history of traveling history, where the patient go or went, and for how long, if he seek the rural or urban areas, if he had any insect bite at that areas, if there is any endemic disease at that area in that time, um, and what about if he drink or swim in local pools, and if he had any relationship with local girls. Then social history is very important in all the cases, including the patient job, with whom the patient living was, and smoking history, alcohol history, recreational drugs, any extramarital relationship, very important in some cases if you are expecting or thinking about infection or sexually transmitted diseases, HIV for example. Past medical history, if he had any medical history of notes like hypertension, diabetes, family history of similar condition or any family history of medical disease, drug list of the patient, very important because it may interfere or exacerbate the symptoms of the patient. Then you have to make summary for the patient. I'm going now to give you summary about the positive data of our meeting today and mention your positive data for the patient, only positive data, and ask him if he has anything else he want to add. Then ask about the concern of the patient, and the patient may have multiple concerns, so that when you finish your concern, ask him about if he has any other concern. Now we are going to make an example for our history skeleton today to apply. So this skeleton is applied for all the patient or all the history taking cases. The main issue here is if you made a good differential diagnosis and made the common and less common like that, so that your approach to the patient or approach to the case will be very easy and you can pick up the diagnosis easily. So we are going now to do an example for the history taking case. You are senior officer of the medical department in the outpatient clinic. You received a letter from your GP. Mr. Bill is 45 years old. He has been complaining of cough and shortness of breath associated with wheezes for the last 2 months. Chest X-ray done for him and the blood investigation all are normal for your kind care. Okay, so what I'm going to do now is to write good differential diagnosis before going to the patient. I have 5 minutes. In these 5 minutes, I have to write good differential diagnosis. So I have to think about this cough, shortness of breath, and wheezy chest all. So number 1 is bronchial asthma, including occupational asthma and exercise-induced asthma. Number 2 is COPD. Number 3 is cardiac asthma. Number 4 is extrinsic allergic alveolitis. Number 5 is Churg-Strauss syndrome. Number 6 is carcinoid syndrome. And the very less common is infection. Infection will not continue for 2 months like that. Okay, so I wrote a good list of differential diagnosis, 6 or 7 differential diagnoses in my mind now. Okay, so I'm going to the station to meet the surrogate. Good morning. Good morning, doctor. I'm Dr. Sadiq, senior officer of the medical department. Nice to meet you. Nice to meet you, doctor. I'd like first to confirm that you are Mr. Bill, 45 years old. Yes, doctor. Yes, Mr. Bell, I have a letter from your GB that you have cough and shortness of breath associated with noisy chest for the last 2 months. Is it right? Yes, doctor. Mr. Bell, can you tell me more about your condition, please? Yes, doctor. These symptoms of cough and shortness of breath and sometimes noisy chest coming with me for the last 2 months, doctor. Okay, I'm sorry for that. Can you tell me, please, when the symptoms started exactly? 2 months back, doctor. Did it start suddenly or gradually? No, gradually, doctor. Is it increasing, decreasing, or the same? No, it is worsening, doctor, more and more. I'm sorry for you. Is it increasing? Is it all the time with you or coming on and off? Actually, doctor, most of the time with me. Okay. Do you notice anything that increase your symptoms like exposure to cold, smoke, and pollens, dust, perfumes, for example? No, doctor, actually, I'm not sure about that. The symptoms with me most of the time. Okay. Do you notice anything that improve your condition like avoidance of cold weather, avoidance of smokes and perfumes, rest time, for example, or being on open area? I'm not sure about that, doctor. Okay. What about your cough? Is it dry cough or productive cough? It is dry, doctor. No phlegm at all? No, doctor. No coughing up blood? No, doctor. Okay. Do you have any runny nose? No, doctor. Any regurg of your nasal secretions backward? No, doctor. What about this shortness of breath? Is it coming with you with exercise or with exertion? No, doctor. It can come with me even on rest time. It can come with you with laying down. Can be, doctor. Yeah. Does it awake you from sleeping, searching for fresh air? No, doctor. Okay. So, any associated symptoms like high temperature? No. Okay. So now I'm going to uh, discuss or ask about my differential diagnosis list after finishing the analysis of the complaint. So number one, I bought bronchial asthma, so I have to ask about bronchial asthma symptoms. Do you have any history of eczema or allergic rhinitis? No, doctor. Any history of such symptoms of noisy chest in childhood? No, doctor. Then now I'm going to ask about COPD symptoms. Uh, do you have you have history of smoking? You smoke at all? Yes, doctor, I smoke. How many cigarettes per day? I smoke 10 to 15 cigarettes per day. For how long now? For the last 15 years, doctor. You didn't think at all to give up smoking? Doctor, I thought about that before, but I failed actually. Okay, we can help you with this issue by referring you to a smoking cessation clinic if you don't mind. It's okay, doctor, I'll think about it. Then now I'm going to ask about occupational asthma and extrinsic allergic alveolitis may be involved in occupational asthma also. May I know what are you doing as a job? Yes, doctor, I'm a farmer. Yes, when you started this job? I started this job 5 months back, doctor. Yeah. Do you notice that your symptoms worsen when you are in the time of job or working? I'm not sure about that, doctor, because the symptoms kept coming with me most of the time. Do you notice the symptoms improve when you are in the weekend? Yes, doctor, when I'm in the weekend and the open area, I think my symptoms can improve. Okay, then I'm going now to ask about cardiac asthma. Um, do you have any chest pain? No. Any racing of heartbeats? No, doctor. Any leg swelling? No. Then now I'm going to ask about Churg-Strauss symptoms. Okay, so do you have any tummy pain? No, doctor. Any burning sensation in your feet or hands? No, doctor. Okay. Any skin rash you have? No, doctor. Then now I'm going to ask about carcinoid symptoms. Carcinoid syndrome symptoms. Do you have any flushing at all, especially in your head? No. Any loose motions or recurrent loose motions? No, doctor. Then now I'm going to ask about infection. Do you have any history of contact with any patient or chest patient? No, doctor. Any history of traveling abroad recently or before? No, doctor. Okay, I'm going now to ask you some questions, maybe not related to your condition, but it will give us a value of assessment of your condition. Is it okay with you? Yes, doctor, it's okay. Do you have any history of headache? No, doctor. Do you have any history of loss of consciousness? No. Any history of checking of your body? No. Any history of pins and needles? No, doctor. Any history of weakness? No. Any abnormal gait? No, doctor. Any uncontrolled urination or water work, or any uncontrolled water work or back passage? No, doctor. Then now I'm going to ask about GIT symptoms. Any history of getting sick or feeling sick? No, doctor. Any history of heart pain or uh, acid brush in your mouth? No, doctor. Any history of tummy pain? No, doctor. Any history of less motions or loose motions? No, doctor. Any history of yellow discoloration of your eyeballs? No. Then judging to urinary. What about your water work? What about, is there any burning sensation during your water work? No. Any history of frozen urine? No. What about the amount? Is it like before? Yes, doctor. What about the color? Any change in the color? No, doctor. Then now about the musculoskeletal. Any joint pain? No, doctor. Any muscle pain? No, doctor. Then now I'm going to ask about social history, which is very important. Okay. Can I ask it about your job before? You are a farmer. With whom you are living with? I'm living with my wife, doctor, and I have two kids. Okay. May I ask if you have any? May I ask uh, a special question, please, if you don't mind? Yes, doctor, it's okay. Do you have any extramarital relationship? No, doctor. I'm straight. Okay, so are you financially supported? Yes, doctor. Do you smoke at all? I asked about smoking before, so no need to repeat the question. Do you drink alcohol? No, no, doctor, at all. Any recreational drug? No, doctor. Then medical history. Any you have any medical history of note like diabetes, hypertension? No, doctor. Any family history of similar condition? No, doctor. Okay. May I know what's your drug list if you are using any drug list? No, doctor. I'm rarely to use drugs. Um, so I'm not regular in specific treatment. Okay, Mr. Bill, I'm going now to give you the positive data. Uh, may I ask you, please, if you have any blood transfusion, any surgical operations, any admission before? No, doctor, never. Okay, so I'm going now to give you summary about our discussion today that you are complaining of this cough and shortness of breath and the noisy chest for the last 2 months, which started gradually and increasing with you, and you feel that it may be relieved in the weekends in open areas and the picnics. Um, you don't have any history of temperature, high temperature, or lose weight, or lumps or bumps in your body. So, Mia, do you have any other thing to add, Mr. Bill? No, doctor, it's okay. So, Mr. Bill, may I ask about your concern, please? Yes, doctor, I'm concerned about the shortness of breath and this noisy chest and cough. What could be the cause, doctor? I made a lot of investigation, blood tests, and imaging, which are completely normal. Yes, I appreciate your concern, Mr. Bill. Most probably that your condition and your symptoms are related to your job because your symptoms are relieved when you are away from the job and you are in weekends. So that's we are calling it is a farmer lung because of sensitivity and for some um, moods molds in the in the work. So what we are going to do for you now is to do for you some other tests and some other imaging and what's called a pulmonary function test to rule out other diagnosis and to confirm our diagnosis. Then, if our diagnosis is confirmed, we will refer you to a specialized doctor, which is a chest physician, to give you the proper plan of management. In the time being, your symptoms may looks to be related to your job, and if this confirmed, we will contact a social worker to provide you with another job um, which is more safe in your condition, uh, and this can be done by a social worker and occupational health care. Is it alright with you? Yes, doctor. Do you have any other concerns? Yes, doctor. Is it curable condition? Uh, Actually, if you are avoided the precipitants of your condition, like the molds and the forms, so your condition may be improved, and with other medication also your condition can be completely cured if you avoided these precipitants. And this issue has to be discussed with the chest physician more and more. Is it alright with you? Yes, doctor. Any other concerns you have? No, thank you, doctor. Okay, like that, the session has been finished, and after that, the discussion um, with the examiner. The examiner will ask you about what's your differential diagnosis of this patient. Of course, you have to put the first differential diagnosis according to the positive data of the patient, not to be a text doctor and enumerate all the differential diagnoses of the case in the book. You don't tell him 7 or 8 differential diagnoses. Only 3 or 4 differential diagnoses are enough according to the positive data of the patient and negative data. Okay, so I'll put differential diagnosis. First differential diagnosis for this patient may be extrinsic allergic alveolitis, farmer's lung, or occupational asthma. Then I can put also bronchial asthma for this patient as the chest X-ray is normal. But again, is that there is no clear worsening factors or precipitants for the patient.